Did you know the leading cause of vision loss for children is treatable, and yet it's not being treated in majority of eye doctors' office? It's less than 10% of eye doctors actually provide the treatment that can actually help through this leading cause of vision for children. And that leading cause is what we call amblyopia, which is a mouthful, but basically it just means even with the best lens possible, that eye is not able to see 20/20. And then to understand why that happens, you have to understand how we use our vision system and how the visual system is formed and developed. It's not something we're born with the ability to know how to use our eyes together as a team. We have to learn how to do that. And the part of your eye that sees 20/20 is the macula, and it's on the back of the eye and the retina, and it's no bigger than a ballpoint pen opening. And for instance, the macula at birth is not even fully formed. It's formed after birth. You've heard young children don't see detail, then that's why they're not ready for the detail. But as you're learning this up through about the teen years, you're learning these vision skills. As you're learning, you can learn what I call the country road method, which will get you through and help you through the younger years. Or you could say, hey, I'll learn the superhighway method. And when you learn that way, you're then prepared to handle catching balls, reading, driving cars, things that we need to do in our later years. What actually happens on amblyopia, as the visual system is being formed and being learned and pathways are getting formed in your brain on how to use our visual system, the brain's realizing it's really difficult to line two eyes up perfectly at that minute detailed level. So then the brain just says, let's just actively suppress the center vision of one eye. And so what we do is we learn to see, like if this was your right eye and left eye, both eyes will be formed and see the car, but only the right eye could, in this case, could see the license plate or the numbers on the license plate. And that will get the person through beautifully in those early years. But then, like I say, they pay for it later with, there where they can't do is have trouble driving at night, can't catch balls, their depth perception's off. The good news, it is treatable. And that's really what we do. One of the many things we treat at Neuro-Visual Performance Institute in Kentucky is we retrain the visual system to learn the proper skills. And once it learns the proper skills, the brain's going to go, that's very helpful. Let's create a pathway for that in the brain. That's called Hebb's Law. Nerves that fire together will wire together. And what happens once that pathway gets formed, it's no different than when you learn to walk, talk, ride a bike, drive your car. Once that pathway is there, it's there for life. And so just putting some effort in on the front end through these activities, exercises, these programs we put together, you can then break suppression in that amblyopic eye at any age with that too. And that's a big myth that you can't do this past a certain age. Plasticity is the other big thing that we hear, just saying it's never too late to fix these things. Hopefully this is helpful. Definitely don't give up on amblyopia. There's lots of choices out there. You just have to find the right doctor to know how to take care of that. Thanks.